Assalamualaikum. My name is Binti Mohamad Shah. Thank you for watching my video presentation. My research title is Evaluation of Health and Safety Risks in Domestic Solid Waste Management Facilities. I was supervised by Professor Dr. Binti Ismail. Currently, the solid waste generation is increasing every year. Population growth, industrialization and urbanization of area were the factor of generation of solid waste. As for that, it is responsible of solid waste management organization to manage the waste from source to land disposal. As for that, this situation might trigger the solid waste management workers as they have to face safety and health risks at workplace. This study consists of three objectives. First, to evaluate the health risk among domestic solid waste management facilities workers who are exposed to various of health hazards. Second, to evaluate the safety risk among domestic solid waste management facility workers who are exposed to various of safety hazards. And third, to determine the level of awareness in knowledge, attitude and practice toward health and safety hazards among domestic solid waste management facilities workers. This study was conducted at selected unit of solid waste management facilities in Kuantan. Company A was responsible to collect, transport and treatment in terms of the sorting of waste, while Company B undertake for waste disposal. The secondary data of higher assessment that obtained from person in charge in both company was used to identify the health and safety risks at each facility. Besides, a structured close-ended questionnaire was distributed to the 162 permanent workers in both companies. A stratified random sampling technique was used in order to select the workers to be involved in the study. To answer the research objective number 1 and 2, it can be summarized in the table. From the high right, it can be summarized the safety risks were very common in solid waste management facilities, especially in disposal site location. The poor road condition was reflected to this facility, such as slippery platform, narrow access, steep road and uneven ground surface. The poor road condition caused the truck overturn and injuries to the workers or drivers. The least safety risk was identified in treatment 3R sorting facility, which covered the hazard for blind spot and sharp object. The reason why this facility was least risk because this activity was done indoor of the port of Company A and not involve the movement of public road. For health risk, the collection facilities were significant to this risk. This is because the workers have to direct contact to the contaminated waste with high toxicity of hazardous compound. The least high risk was identified in treatment facility because the workers not directly contact to contaminated waste from the source. Now, let's move to the objective number 3. At least 40.7% of workers was in 30 to 39 years old were involved in the study. 50% of the workers have 1 to 5 years working experience. From the finding, it found that the highest symptom of disease faced by the workers is headache, while the lowest is shortness of breath. Besides, 30.9% of workers face diarrhea disease from past 12 months, and at least 3.1% of workers suffered chronic cough. In terms of injuries, 31.5% of workers has cut and wound injury from past 12 months during their service, while only 4.3% has experienced in bone fracture. From the descriptive analysis of data, the highest percent is 39.5% has poor knowledge in health and safety risks at workplace, other than 30.9% has good knowledge. Besides, at least 26.5% has good attitude and follow instruction to handle the health and safety risks, while 37% poor attitude for this domain. For practice, mostly 45.1% workers had lack of practice in managing risks at workplace. Study can help organizations to identify the potential health and safety risks at each domestic solid waste management facilities. Besides, this study can help organizations to protect the workers from any injuries and disease that cause loss of work time. And then, this study can help organization to improve the knowledge, attitude and practice among SWM workers in managing health and safety risks at workplace. As conclusion, this research study has achieved all of the objectives, but there is limitation for this study. Not all of the waste management facilities were available in Kuantan. For example, the treatment facilities such as material recovery facilities were available at outside Kuantan State. And then, the location of unit facilities separated each other. For example, the collection and transportation of waste were done outside of the port of Company A, while the treatment facilities in terms of trash sorting were done at indoor of the port of Company A. And then, the waste disposal was done at landfill area of Company B. As for that, I recommend for further study to conduct this study at all unit of facilities that involve in solid waste management. That's all for me. Thank you.